My next guest is Rob Turner with Advanced Hospitals of Dallas. Welcome, Rob.
Pleasure to see you, ma'am.
Likewise. Can you tell me a little bit about yourself?
You bet. A hospital CEO by background. Before I ran hospitals, acute care hospitals, I ran long-term acute care hospitals as well as skilled nursing facilities. And years before that, I was a medical lab tech in the Army. So
And what skilled facilities did you run? Were they here in Texas?
they were in Texas, a couple out of state as well. Worked for Manor Care, worked for Integrated Health Services, which became Mariner, and a couple of other private groups, Houston, and one facility up here in Dallas as well.
What drew your company to partner with OPCO?
OPCO is a great organization. Obviously, there's a lot of facilities in this geography in the DFW DFW area. And there was a lot of open mindedness as we talked to the administrators and the directors and the clinical staff. We definitely saw a commitment to quality and excellence in everything that they do. And I think there was just great synergy for us as a small hospital. We're able to do a whole lot more hand holding with the patients and maybe communicate more effectively than some of the bigger system hospitals in a way that your business is better protected and you have a better idea of what's happening with the patient when they're with us and certainly when they're coming back and making sure they come back, of course.
That's the most important thing is getting that patient back to that facility, correct?
Yes, ma'am. Yes, ma'am.
So basically, most of the patients in OPCO from their nursing facilities, if they need to go to the hospital, they would come to Advance. Is that what I'm kind of
That is the
typical?
instance. Yeah, in a lot of instances. So we really exist in a way to solve business problems for what we consider community partners, and skilled nursing facilities certainly qualify for that. Sometimes that's small procedures. Sometimes it's bigger procedures, vascular studies. Sometimes it's fractures, etc. Most of the time, though, it's small procedures. You know, a G tube fell out and it just won't quite stay back in, or it needs to be resized, or PIC lines and peg tubes. A lot of the smaller stuff that just we're able to do at the hospital and get the patient right back to the facility as quickly as possible.
What do you enjoy most about working with OPCO?
You know, I think it's really the commitment that I see in the leadership, and it seems to go from top to bottom at the facility level as well as the corporate level. There's certainly a commitment to quality of care, and they certainly care about the patient. And they've got operations to run, and they're committed to that excellence as well. But really, what I see in them is something that I always tried to do myself when I ran facilities, and certainly what I try to do now, and that's just really caring about the patient and giving them the best possible outcome.
I'm hearing that a lot in most of my interviews today that the OPCO leadership is great, their staff is great, and what they care about most is putting that patient first. Patient care comes first. That's
We
huge.
certainly experience that. Yes, ma'am.
Yes. What are some of the biggest challenges skilled nursing facilities face right now? And how is your company helping OPCO navigate that?
It's a great question. I think it's the same problem that skilled nursing facilities have always had, especially in the state of Texas.
Don't say it. Staff?
Well, indirectly, see, I think it starts with reimbursement and the fact that we're being forced to take sicker and sicker patients into the community environment, and we're being asked to provide the highest quality of care. And Texas is not really a great state as far as reimbursement is concerned. So it's definitely challenging. And as a result of that, being able to staff and give the patients everything we would want to give them and obviously still keep the lights on. So it's a challenge. I think OPCO does it better than most, and they do a great job with systems and programs, training with their staff. They're constantly present as leaders. We see administrators walking up and down the halls. We see DONs walking up and down the halls. There is a commitment to making sure these patients get everything that they could possibly need. And then for us to come alongside OPCO and partner as a hospital system, you know, really is a function of picking up where things leave off in long-term care or in skilled nursing environments, so we can bring that acute care partnership to bear some of our resources as well, and as a result of that, maybe help with some of the financial burden of care, but certainly help with the acute nature of these patients, and of course stabilize them and get them back to the facilities.
Good. Good to hear. Can you tell me where Advanced Hospital is located?
Yes, ma'am. I think it's considered North Dallas, although I always consider North Dallas somewhere north of 635. But we're Walnut and Greenville, across the street from Presbyterian. pretty close to the Walnut and 75 exit, which again they call North Dallas, but that's kind of to me just getting into Dallas. And I always thought of get north of 635, but that's our area, and we're proud to serve that community as well as really anyone who needs us in the DFW area.
Awesome. Well, Mr. Turner, I want to say thank you for sitting down with me. And I just want to let you know that OPCO values the partnership that they have with you. And again, I thank you from Synergy Innovators.
Well, we're grateful for you and your work. Your podcast is well known, and I just think you do an extraordinary job pulling out information. And obviously, you're a great partner to OPCO as well. And I appreciate you taking the time to talk to me today.